Hey everybody, I'm Dr. Nicole Lindsay.
Dr. Brian Jeanette, welcome back.
We're here at Back in Balance, and we are here to talk about spinal hygiene.
Spinal hygiene is so important. Spinal hygiene is just this series of good, healthy practices that are designed to create a daily balance and movement of the spine.
Yes, just like we do with our teeth. We get it with our teeth. I don't know if you remember that dental association or local dentist coming into your school when you were in elementary school and making you chew on that red pill, educating you about the importance of
Horrible
tooth decay.
Horrible memories of being made fun of by not brushing my teeth good enough when I was 8 years old.
Well, the whole point of that is to teach you that if you do not brush, you do not floss, and break up the plaque and the unhealthy buildup around your gums and teeth, then your teeth will rot and you'll end up with health problems.
Very, very, very similar to what goes on in the spine, right? And so the purpose of these movements is just to help to break up the tension by rolling, flossing, moving, creating blood flow, more ease of the tissue to help remodel and strengthen the bones in the joints, right? On our teeth, we can see when our teeth get yellow, we can see when we get cavity, we can feel when we get cavities. We can see them getting unstraightened, they get curvy, you need braces for that, right? But we can't see when that happens in the spine.
Unless, of course, you go to a chiropractor. But one of our colleagues says if your spine was on your face, you'd take better care of it, and that is the truth. So what we're here today to do is talk to you about spinal hygiene. And these are simple movements and things that you can do on your own to keep movement, to keep nutrition, to keep health within the body so that your spinal segments move, your spine stays as aligned, supported, strong as possible so that you can be healthy.
Right, so today we're going to go through all 5 exercises and movements in our spinal hygiene kit, but we've already made videos on these before, so you can always reference back to this video that we'll have saved and reposted later, or we have our YouTube channel where we have the demonstrations and going through the explanations again, each individual. Today we're going to talk about how to floss the spine. We're going to talk about foam rolling the spine to help break up the adhesions. We're going to talk about how to hydrate the disc in the lower part of your spine. We're going to talk about how to remodel or remold the tissue. And then we're talking about how to support your tissue, support your spine, make it strong and stable.
We feel so strongly about spinal hygiene that we created this kit for you. Every new patient in our office gets one of these, and we give them instructions via videos or our ebook so that moving forward, you know how to take care of your spine forever. So let's jump in.
I think I got a bug flying in my eye, so I'm going to keep touching my eye until the bug is gone. I don't know, mosquitoes. It's summer.
Eye hygiene, that'll be the next one.
Eye hygiene, yeah. Wash your hands before you touch your eyes, kids. Don't do it. So, like we said, the first part that we're going to go over is how to floss your spine, right? And this is just a good series of spinal movements to help maintain flexibility and to help maintain range of motion in your spine. This is the old adage: if you don't use it, you lose it. If you don't use your full range of motion, your body's going to help to create scar tissue around that area to help strengthen and stabilize that area. And the scar tissue, it's not as strong, it's not as elastic, it's not going to serve your body as good of a purpose as regular healthy muscle tissue does.
And how many times have you been sitting in one position for a long period of time, whether it's at your computer or maybe on the couch watching TV, and then you go to get up and you just hurt a little bit. You have to kind of
ease
into that standing up position, or maybe it's your knee. You know, a lot of times that is because you have built up inflammation in that area. There are adhesions, scar tissue from not having enough motion. So the first exercise in our spinal hygiene kit is flossing the spine.
Right. So one of the easiest ways to just prevent this buildup of degeneration in scar tissue is just to move it. If you work on, there we go. Dang. Okay. If you work on just actually moving your spine, you're not going to build up scar tissue in that area. So when we talk about flossing the spine, we talk about 2 particular areas of the body. First in the neck, and then in the low back. And these are very, very easy to do. It's simple range of motion exercises. We're going to go through as much range of motion as we can in the neck to help create and establish that range of motion over a long period of time. So when Dr. Nicole is in this position right here, she's going to do 2 motions. She's going to do rotation in her neck, and she's going to do what we call lateral bending. So she's going to take one ear to one shoulder without raising up her shoulder. She's going to try and go as far as she can to one direction. Nice and slow, she's going to hold it there for a second, and then she's going to switch sides. You know, a lot of people are going to feel tightness in their upper neck or their lower neck or their upper shoulder area, their trap area, and they're going to, one side's going to be more tight than the other. This is definitely indicative of something going on in the muscle itself. Either a trigger point's been built up or a myofascial adhesion has been built up. That's going to cause reduced range of motion.
If you hear noises, popping, cracking, anything like that when you're going into these motions, in and out of these motions, that's okay. That's just gas buildup in the tissue. If it hurts when you're doing these movements, or you feel dizzy, tingling in your face, down your arm and shoulder, stop immediately and make an appointment with us and let us know.
Something's going on in that area that's causing dysfunction in the tissue, it's causing dysfunction in the joints, and then it's putting pressure on the nerves surround that. And those nerves go all the way down your shoulders, your arms, your hands. They can go up into your head, causing headaches. They can go to your eyes and your jaw. They cause a whole host of problems.
So how many times should they be doing this?
I want you to do this 3 times or 3 sets, and you're going to go through each series of range of motion 5 to 7 times, right? So the next one that she's going to do in this position, when she does rotation, she's going to turn her head and look over. She's going to keep her shoulders square, keep her chest square. She's going to turn her head and try and look over one shoulder as far as she can. Again, not going as so far to cause pain, discomfort, irritation, but just far enough to get a good stretch in the range of motion.
You may find that one side goes farther than the other, so that also indicates a problem. But you just want to keep flossing as long as there's no pain, numbness, tingling, dizziness. Keep flossing those segments and the tissue.
Yeah. Let me tell you why this one is the most important one that we're going to do. Who has been driving on the road or being a passenger in a car and have seen somebody turn out, or try and change lanes, and they don't look at their mirrors, right? You can't turn your head to see behind you or to see over in your blind spot, right? So many people are out there driving right now that lack this range of motion, that lack the ability to turn their head, or they can't actually see your car. So, they just, pray and hope there's no car there because they can't see you.
We hear that at least once a day in the office, which is very scary.
It's super scary.
Happening, a lot of people that aren't chiropractic patients yet are driving around not able to see over their shoulder, which is scary.
I know.
So the next movement is the lower back. So this is very similar to what we do. However, these movements are geared toward,
Yeah.
So what Dr. Bryan is going to do is he's going to simply bend forward and back up and back into extension, and then come back to neutral. So this is flossing the lumbar and the thoracic spine in this movement.
One of the things that's very indicative of when we bend over and we have pain in that area is that we already have a lot of scar tissue built up in that area. Most of the people that we see, and actually a lot of people that are walking around today, they can't bend forward without having pain. When we bend forward, the joints in our lower back should allow us to bend forward. We shouldn't have any pain with that, right? It's as simple as bending over the sink and doing dishes, bending over the sink and brushing your teeth, bending over first thing in the morning and tying your shoes.
You should be able to bend.
Yeah, absolutely. When we bend in this position, each of these individual spinal segments should move independently of each other. Same thing when we go backwards.
When you move, your bones should move with you. So if your bones are stuck in one place or another because of scar tissue buildup from old injuries, trauma, disc degeneration, your bones will not move with you. And that's when you go down to pick up a piece of paper off the floor and your back goes out. It wasn't that one particular movement and that piece of paper that threw your back out. It was the years of buildup, time and time again, that created damage. And that one time you bent over, you flossed your spine, your bones were not able to move with you.
And your muscles and tissue just had enough. They, had it up to here, and then
they gave out. And this is something that, as you're doing this, if you do feel pain, let us know, because we do motion study x-rays in our office where we actually examine how well your bones are moving in these positions so we can see if they're stuck or not. The second movement is going to be a lateral movement, and basically this is for the lumbar spine as well and the thoracic spine. So what we're going to do is simply flex the body over from one side to the other, laterally bending. And you can hear noises happening in my spine. So
she's still loosening. Dr. Cole exercised this morning, so she's flexing her spine, getting loose after exercise.
Exactly.
Yeah. This is also very, very important because so many activities in our life don't allow us to do this movement in this motion. And this is one of the movements in motion that is actually going to, when patients come in here, tell us, oh, I was reaching kind of over across my body and to the side. That's what did it. Not necessarily leaning exactly forward or leaning exactly back, but they have this side-to-side bending. Well, we don't do a heck of a whole lot of side-to-side bending. And again, it's the principle of if you don't use it, you lose it. If you don't use this side-to-side bending, you're going to lose the ability to be able to bend that way.
Exactly. How many sets and repetitions do you want them to do?
Same thing. So I want to do 3 sets, 5 to 7 reps to each side. So 10 to 14 reps total.
Perfect. So that is exercise number 1. Exercise number 2 is going to be using the foam roller.
Listen, this is one of the 21st century's greatest inventions. Actually, probably invented in the 20th century, but we've been really. I know. There's a lot of different types of foam rollers. We have a high density foam roller that's about 6 inches diameter, and I actually really like these 18-inch ones. They're very easy to travel, very easy to bring with you in lots of different places. So the really big purpose of the foam roller is to work on breaking up these adhesions, and this is something that falls in the category of myofascial release. So what is fascia? If you can kind of think of fascia is this small little tissue-like paper that sits on top of the muscles, that sits beneath the muscles, that surrounds the muscles themselves, and helps to just connect all our muscles, ligaments, tendons, and bones together. When Dr. Cole was referring to sitting down for a long period of time and then standing up and having that couple seconds to stand up, one of the things that causes that are these myofascial adhesions or restrictions in the muscle. I promise you, a lot of your joint pain is not actually coming from your joint. It's coming from restriction in the muscle tissue itself. So the foam roller is a really great, simple, low-cost tool to help break up these adhesions.
Yes, and because the majority of us spend our lives sitting and looking down because we're on our devices, now more than ever, this is part of our spinal hygiene kit, this particular movement. So what we're going to do is make sure this is low enough so we can show.
Work with us. Cool. So Dr. Cole here is going to work out a lot of the myofascial adhesions and a lot of the trigger points or stuck joints in her middle back. The middle back is so important because that's the gateway. That's the bridge that connects our neck and our lower back, and that takes a lot of tension. So what she's doing right here is she's on her back, and the foam roller is right in the middle part of her back. Hips are on the ground, and she's actually controlling it with her feet. From here, she's going to drop her head and drop her shoulders and actually kind of bow over that foam roller. Now, this is going to put a lot of pressure on the joints and help to move the tissue in that area. So you can do a couple things with this. The first one she's doing is just very static and sitting there. The second thing is what she's actually doing right now. She's actively going to be rolling it up and down over the spot in her spine. Now, ladies with long hair, be careful, because if Dr. Nicole were to go up a little bit higher, she's going to roll over here and pull her hair out. Ponytail that thing. Going up, and when we find the trigger points, when we find the spots that are really stuck, really tender, you know that you're on it, and you say, oop, that is the spot. Stay there for 2, 3, 4 seconds, right? And then continue to make these long, broad, sweeping passes with this. our exercise enthusiasts out there, people that exercise a couple times a week, or even just 1 time a week, whatever. This is really good for pre-exercise, and this is really good for post-exercise with that. We can use this foam roller on any single muscle or area, joint in the body.
We have an awesome ebook too.
Yeah,
we'll put a link for that in here as well, which shows you how to use the foam roller everywhere.
Right. And the foam roller is a really simple way to utilize your body weight to accomplish.
Sorry.
I know. We need a little GoPro like Justin. To accomplish breaking up these adhesions with gravity and just using your body weight. So it's really, really good and pretty cost effective and pretty quick.
Yes. So at minimum, foam roller for your spinal hygiene is the movement we just showed you. The third exercise is going to be all about hydrating your discs. And we have a hydration wobble disc that we have as part of our hygiene kit, which can help you do this.
Sorry, going back to the foam roller kit, I want you to do 3 sets of 30 to 60 seconds with that, and using as much force or as much pressure as you can stand. Same thing applies to this. I want you to do 3 sets, but instead of 30 to 60 seconds, I want you to do 3 sets of 20 repetitions with that. This balance disc is awesome. We have patients come in here all the time that just say that I don't care about doing anything else. I just want to get on that wobble chair and use it. Well, good news is you can do something at home with this now. And the main purpose of this is to help bring more blood flow, help bring more healthy oxygen, help bring more nutrients to the lower part of your spine. And it works on the principle of movement creates more nutrients to the spine.
Yes, we have as part of disc therapy in our office a Wobble Chairs that is part of a protocol where patients will do a series of exercises on the Wobble Chairs, which will do exactly what this does for you at home. So basically,
You can sit on it.
I'm gonna get
Technical difficulties. So you can just see that it's blown up pretty thick. I'm gonna sit down on it. I'm gonna put it right under my butt. And actually just sitting on this is gonna actually force you to be in proper posture. When you're sitting on something that's blown up like this, whether it's a balance disc or like a really big yoga type ball, you're not gonna feel like it's necessary to slouch. You can sit up straight with this. So I'm doing, sit up straight, shoulders back, head up. My belly button is just slightly being pulled in and up into my spine to protect it. And I'm gonna do 3 exercises or 3 movements for this. The first one is front to back. The second one is side to side. And the third one is a good stretch, reaching your arm all the way across your body. You're gonna stretch all along this side right here. So this is the stretch that we're gonna do. And I actually want you to hold this one for 20 to 30 seconds. We're gonna do these for 3 sets. You're gonna hold each side for 20 to 30 seconds. Now I'm really trying to separate my pelvis from the rest of my body, right? Doing these and kind of moving my whole body is not targeting the lower back like we want it to. So I'm thinking about just my pelvis. So what I'm gonna do is I'm gonna tuck my pelvis, my belly is gonna go forward, and dip my pelvis forward, and then I'm gonna curl my pelvis backwards. Forward, backwards, forward, backwards. And I can go pretty far with this because I'm pretty good at this because I've been doing this for a long time. My lower back spinal hygiene has definitely improved quite a bit. So I can take a really far range of motion. If you're not quite up to that level with going as far range of motion as I am, that's okay. You can do just a tad bit. So 10 forwards, 10 backwards, or 20 total reps. Then this third one that we talked about side to side, I'm taking my pelvis and I'm dropping it one side, dropping it to the other side, dropping, dropping. Just like this. I'm just trying to think about going side to side. So I go side to side, and then I'm going to reach my arm up and stretch that. So 3 exercises, 3 sets of 20 reps, or 3 sets of 20 seconds with that. And this is something that you can actually, you don't have to do these exercises to sit on this ball. You can put this ball, you can put this balance disc on your work chair. It's going to force you to be in good, proper posture. And the other thing it's doing is actually forcing my ball without falling off.
Perfect. And by the way, if you are not a patient and you would like one of our spinal hygiene kits, You can purchase them. We'll send it out to you. All we need is your address, and we'll put the link in this thread, so that way you can just purchase, and we'll send you the kit and the Spinal Hygiene ebook with the instructional videos, pictures, and explanations on how to do this.
Made it back.
The next one is all about remolding the tissue. And we have in our kit what's called a dinner roll. Not a dinner roll, a dinner roll. The dinner roll
You
is...
try to say dinner roll again?
Got dinner on the mind. Is specifically designed to work on the ligaments of your spine, specifically your cervical and thoracic spine, to get the curve back in there. Again, we find that most patients, even children these days, are dealing with
It's even worse than kids.
Reduced cervical curve or even a reverse cervical curve. So a normal cervical curve should be roughly 35 to 45 degrees. A person's in this position, in a C-shaped position, and their ear should be directly on top of their shoulder. But this is what we're finding because of forward head posture activities. So this is something as part of our spinal hygiene that we want you to do every day to ward off this posture. And how we do this is we're going to lay down, and you're going to place under your neck, right at the base of the cervical spine and the top of the thoracic spine. And simply lay there. If you are not a patient and you've never done this before, 3 minutes. No more than 3 minutes the first time. Every day, you're going to do this and gradually add more time each time you do it, as long as it's comfortable. And add a minute each time. And you want to get up to 15, 20 minutes tops on this dinner roll a day. And just simply laying like this will relax the ligaments, will help get your head back on top of your shoulders and improve that cervical curve of yours.
So it's good meditation time too.
Exactly. And oftentimes you can feel and hear things kind of moving into place in your cervical spine as you're laying here. So it's a great movement, great exercise for you to do on your own every day, just like brushing your teeth.
Absolutely. This is wonderful. We actually have patients fall asleep on this. This is how relaxing it is in lots of cases.
The very last exercise of our spinal hygiene kit is all about supporting and strengthening. So these exercises are all geared towards spinal health. Of course, we're big into exercising. We want you to strengthen and support every square inch of your body. But today we're only talking about the spine and the muscles close to the spine so that you can support that and strengthen that. So these exercises are geared towards keeping your head, your neck, your shoulders back on top of your spine.
The more time we spend forward, the more time our shoulders spin rounded forward and our head spins rounded forward. Those muscles that connect our neck to our shoulder to our upper back, they get stretched out, and when they get stretched out, they get weak. When they get weak, our body instinctively wants to tighten and shorten them and bring them back, but we're playing tug of war with our muscles, ligaments, and tendons in our neck. We're forcing our head forward and our body's trying to force that back. But for us, we're like, wow, I don't like this good posture position. This is super uncomfortable, so I'm going to resist that motion. This is the perpetual tug of war that our body is constantly going through. So we actually have to work on strengthening them. And just like Dr. Nicole said, we want to work on strengthening all the other muscles in the body, but today we're going to just focus on the ones that cause and contribute to forward head posture. For this, we use a band. When we use this band, we can actually use this for a lot more exercises than the ones that we're just going to show you, but we're just going to go show you the first ones right here. So we're talking about the forward head posture. So her shoulder's going to be back, her head, or her ears are going to be directly over her shoulder, and she's going to keep her chin kind of tucked. Her goal is to maintain her head in this position and not to move it. What she's going to do is she's going to do like a little tricep extension. She's going to keep her arms out and she's just going to pull her arms forward. The act of pulling her arms forward is going to cause her head to want to come forward, but she's going to continue having that good posture, continue bringing the neck, chin back. Chin retraction is what it's called. And she's going to hold this position for 5 to 10 seconds. 5 seconds if it's too hard, too uncomfortable. 10 seconds if you're getting more strength built up in this.
Where you will feel it the most is in the little teeny tiny muscles that surround your neck and head. You'll even feel it into the front.
Right. This is incredibly important to fix and reverse that forward head posture that we're dealing with. Now these bands come in a variety of strength or resistance, and this red band, Dr. Nicole's pretty strong. This red band's pretty thick. So they come higher and they come lower with that. So we definitely have a lot of different options for you to choose from in terms of resistance. But arguably strengthening the muscles in the neck is going to cause a lot of those trigger points to decrease or to lessen.
Exactly. So repetitions?
I want you to do 3 sets of 5 reps, holding each rep for 5 to 10 seconds.
Perfect. So there you have it. That is our spinal hygiene kit and the exercises that you can do daily to get healthy movement into your spine, to keep your tissue and your spine as healthy as can be. So the movements are, once again, number 1, flossing.
Number 2, foam rolling.
Number 3, hydrating.
Number 4, remold the tissue.
And number 5, supporting and strengthening the tissue.
Boom.
Awesome. So once again, if you would like a spinal hygiene kit, the link to purchase one will be in this thread, and let us know if we can help you. If you're doing any of these movements and you experience pain, numbness, tingling, any kind of discomfort, please let us know and we'll be happy to help.
Absolutely.
Thanks for watching, everybody.
Thanks.